and welcome to the Our City COVID-19 show. I'm Vicky McCullum. In response to the worldwide pandemic and South Africa's 21-day lockdown, Cape Town TV has made the decision to collapse most of our in-house shows and instead bring you a daily bulletin updating you on the latest information and resources around the COVID-19 pandemic while unpacking deeper issues as they emerge. This is World Health Day. We salute each and every frontline worker who is putting their life at risk in this battle against coronavirus. As you continue to protect human lives in these testing times, the nation stands in solidarity with you. With that said, we do encourage our viewers to get in touch with us. We want to hear from you as we welcome contributions from movements, healthcare providers, and our audience. We want this program to be a two-way flow of information, so please get in touch with us via our social media platforms and our email. And now for the news. As we enter day 12 of the lockdown, the current spate of confirmed COVID-19 cases are 1,686 infections with 45 recoveries and 12 deaths. A proposal to use schools' hostels as isolation centres to house patients recovering from COVID-19 has not been met with a positive response by the Provincial Education Department. Head of the WCED, Brian Schroeder, said in a letter to principals that although they had great sympathy for the needs of the health department in combating the pandemic, their position was that schools would reopen soon. But, said Schroeder, should schools be closed for a period exceeding 2 months, the WCED could reconsider its position. Plans by the family of murdered Cape Town police officer Sibusiso Qudushe to bury him in the Eastern Cape have been set back due to regulations stipulating that only 7 relatives can travel for funerals. His widow Pumela said the family had made arrangements for Saturday, but that officials had scuppered that plan. 36-year-old Qudushe was off duty when 2 suspects entered his house, shooting him dead. Police were still following up on leads while the Hawks were investigating the killing of 2 other officers, Constable Tobinqebo Kotelo and Special Task Force member Mulungisi Kidwell Ranaka. Western Cape MACO member for Safety and Security, JP Smith, says the city's law enforcement officers have made over 95 arrests in the last few days. Charges ranged from drunk driving, violating national lockdown regulations, and drug possession. The city's traffic services issued 16,348 fines for various offences. Smith encouraged citizens to abide by lockdown rules.
City enforcement departments made 95 arrests the last few days on a number of charges from drunk driving to bribery to possession of drugs, malicious damage to property, and in some cases additional charges of violating the national lockdown regulations. While there appears to have been a downturn in some crime categories, it's business as usual for some criminals based on the arrest statistics of the past week. Our staff are doing their utmost to enforce the lockdown regulations whilst also tackling ongoing criminal activity. Over the weekend, Metro Police officers confiscated R500,000 worth of alcohol in Dunoon from a tavern that was still operating on the sly, despite the lockdown ban on the sale of alcohol. Officers also had to stub out an attempted R5,000 bribe from one of 2 suspects who were caught selling cigarettes in Mfuleni. Cape Town has a very low rate of corruption within our enforcement agencies, but the suspect clearly didn't receive the memo and now faces more charges than he bargained for. In one of the latest successes this morning, Metro Police officers conducted crime prevention patrols in Lansdowne and noticed 2 men loitering at the side of the road. The men ran away when they saw the officers, but one of them was caught after a short chase. A search of his bag revealed a pickaxe, a hacksaw blade, and a knife. Officers returned to the spot where the duo had been loitering and found cables that had been cut, ready for removal. The 31-year-old was arrested and charged with malicious damage to property, attempted cable theft, and a contravention of the Disaster Management Act. The city's traffic services issued 16,348 fines for various offences. In addition, all the safety and security departments are doing many more operations, often in conjunction with other role players, and patrolling neighborhoods to ensure that law and order is maintained. I call on communities to obey the lockdown and stay at home. Our officers are doing all they can to keep residents safe, but this requires a collective effort.
As the reality of the national lockdown continues, feeding schemes will continue to help the needy and homeless. The woman dubbed the Mother Teresa of the Cape Flats, Venetia Ogle, who provides food to the homeless living in the CBD, has moved on to feeding people from Heathfield to Woodstock. She has managed to feed up to 200. Now it's time for an ad break. We'll be back soon. Stay with us. During the lockdown period, Teresa also announced that the department had allocated 1.2 billion rand to help small-scale farmers.
Together with industry, the department is monitoring food supplies through the agricultural value chain tracker. Where there are challenges experienced within the value chain through this tracking, these challenges are escalated for immediate attention to the relevant regulators. I have to repeat again that there is no need for panic buying, as such buying only serves to create artificial shortages in our food supply chain. The qualifying criteria for our small farmers is that all those who apply must be South African citizens who have been actively farming for a minimum of 12 months. Farmers who are currently in production, they must be registered on Farmer Register or commodity-based organization or in any of the provincial database that are with their farmers' organization. We like to indicate, though, that those who are not registered will actually be registered at the point of application. We are also targeting farmers who are farming in communal areas or, as it is known, traditional areas. The smallholder and communal farmers with an annual turnover from 20,000 and 1 million annually. We also would like to indicate that those farmers who will support must also be applying good farming practices, because this is important in order to ensure that we protect our environment and we maintain our soils for further production. I must emphasize that the adjudication will observe the following minimum qualifications for allocations. We will ensure that we identify and target women at least 50% on those who would have applied, youth 40%, and people with disability at 6%. It is also important for me to indicate that this intervention is excluding mechanization, infrastructure, and other overhead costs. This is not a comprehensive support, but an intervention with regards to the challenge that the country is facing.
There has been some confusion about how employees who will not be paid during the lockdown can access promised financial help from the Unemployment Insurance Fund. Ayanda Nabe spoke to Makasonke Buthelezi, the Director of Communication and Marketing of the UIF, about this and how employers and employees can apply for relief.
Hi everyone, my name is Ayanda Nabe, and we're watching our show on COVID-19. Today we're speaking to Makasonke Buthelezi, the Communications and Marketing Manager of the UIF National Office, and we'll be talking about the UIF benefits in the context of COVID-19. Makasonke, hello and welcome.
Good morning, Ayanda, and thanks for having me.
Thank you for being here. But Makasonke, what we're wanting to discuss today are the benefits that you have. We know government has developed or strategized on mitigation strategy to deal with the impacts of financial loss for employees during these trying times of COVID-19. Please could you take us through some of them, please?
Yes, thank you, Ayanda. Yes, it's true. The Department of Employment and Labor has established the COVID-19 TERS benefit for those companies who won't be able to pay salaries during this time of the lockdown. Now, this benefit, as I've said, is applied for by the employers. The employers have a huge role to play in terms of facilitating the access of the COVID-19 TERS benefit. What employers are supposed to do, those who cannot afford to pay, is to send an email to COVID-19 TERS@labour.gov.za. What will then happen is that there will be an automatic reply. In that reply, there will be steps that outline what the employers need to do in terms of accessing the benefit. The benefit is solely to assist with salaries of these employers who find themselves unable to pay the employees during this time.
Okay, what you've said right now, Makosonge, is that the employer will need to send an email. What should this email entail? I mean, there are various benefits, if I'm not mistaken, and one is curious to know what should these, the details that they submit, what should they be?
What happens is once they have sent the email, on the email there are attachments. The attachments, one of them is where they have to fill out, I would say, a form. It's not really a form, it's a spreadsheet where they must give us information about the employees for whom they are applying. These I'm talking about their work numbers, usual details they will have to fill out. How much do they earn per hour? How much do they earn per week, per month, and so forth. And the reason why we want those details is, one, is to prevent a situation where a company applies for a ghost work. That is the first thing. Secondly, we need those details so that we can check if the employee is registered with the fund. That will help us a great deal because we prioritize those employers or employees who have been contributing to the fund. So we will match that with what we have on our database. There are situations where you have employers who are contributing to the fund, but you find that they have 100 employees, but they are only paying for 90. Now, in this instance, we need to get all those facts and say, hey, we have realized you've been paying for only 90. What about the 10, you know? And then we will have then to negotiate. So as part of the documents that are also there is the MOA, which is very critical because once part of the process is once we've done the administrative process of checking the employees and also through the information that we received from the employer, checking how much, in fact, of this funding we need to give to a company, if it is a company, then we would have to sign a MOA with that company because in some instances, like I said, a company you'll find that owes us as UIF. You know, in that instance, we need to agree that, okay, we will pay 100% all your employees, but you must know that you owe us for this 10 that you never paid for. And then this MOA will cover such instances.
All right. I really want us to get into these benefits. What are they? What are these benefits? I know we've mentioned about 4 of them. Maybe we could talk about each one of them in a little bit more detail so that our viewers can have a sense of what exists out there.
No, with COVID is only one benefit. COVID-19 is just one benefit, and it's for the period of a lockdown, for just this period, the 21 days only, where you are unable to pay. Yeah, it's just for this period. It's nothing more than that. And we also have what we call the reduced working time.
Yes.
Yeah, reduced working time is an already existing benefit, okay, that workers can also apply for, where maybe they usually, if under normal circumstances, would apply for reduced work time if the employer says, due to the business not doing well, we think of instead of working 7 days, you may work for 5 days.
Yes.
But it is applicable in this instance because obviously people won't be working for 21 days. So they can also apply for the reduced working time, and they can do so online. We have put on the Department of Labor website steps that they need to follow in terms of accessing the reduced work time benefit. But besides from these ones that are related to COVID-19, people can still apply for the normal unemployment benefit. They can still apply for the maternity benefit. And I think the other one that I need to mention is the illness benefit.
Yes.
Now, the illness benefit can also be applied for by those employers or employees who, due to this situation, have decided that, no, I needed to self-quarantine for 14 days, and they agree with the employer, and the employer say, well, I won't be able to pay you, or I will pay part, and then they can apply for the illness benefit. Now, all of this can be done online on the UIF filing.
So here's the thing, Makosonke. An employee realizes that, you know, my family member has been in contact with someone who has traveled abroad. I suspect I might have contracted the COVID-19 virus. However, I am not sure. I do feel it would be safer for all my colleagues if I stayed at home. Now, when you say that the illness benefit applies to those who have quarantined, does that include voluntary quarantine, or is the quarantine, should the quarantine be approved by the employer before then it is recognized as a quarantine that would enable me to apply for the illness benefit?
Thank you for that question. It's exactly that, self-quarantine. We are saying because you have to, when you self-quarantine, the period given is 14 days. So we are saying if you take that decision and say, I want to self-quarantine myself, you have to obviously inform the employer to say, I'm in this situation, I think I may have contacted the virus, and I think it's good for me and my fellow employees for me to stay at home. And then on the website, there is a form that it's a letter, actually, an undertaking that will have to be completed by the employer and the employee. So for this, that is the arrangement. Usually for illness benefit, we would want a medical certificate.
Yes.
But we are saying in instances where it's self-quarantine, it's enough for us to get this letter from the employer and the employee, which is already on the website. However, if it happens that you go back and you test positive, obviously the medical practitioner will then give you a medical certificate. Then you will come back with the medical certificate and say to us, it's confirmed I'm positive, now I have to self-isolate as per the recommendation. And then on the strength of the letter, then we extend then the benefit for whatever period that you'll be staying at home.
Okay, there's another one that I'm very interested in. And of course, CTV, we've been getting a lot of queries from our viewers. Looking particularly at the national, NDB?
The national, what is it now? National Disaster Fund.
Disaster Benefit, yes.
Okay, benefit, yeah. This is basically the same thing. It is COVID-19. I think when it was conceptualized initially, that's what it was named. Mm-hmm. But as we go along, then it was changed to COVID-19 terrorist relief benefit. It's basically one and the same thing. Wow. And what you would realize is, you know, because this is a new thing to all of us.
Yes.
You know, ideally, absolutely, if you do something like this, you'd want to start by piloting it and see if it works. But now we don't have the luxury of time. So what I'm mentioning is that as we go along, we learn a whole lot of things. We identify gaps, you know, hence even the name changed.
Yes.
You try and refine things and make it better. I mean, when we initially started, we had what we call the Easy 8 guide.
Yes.
which was on the website. I don't know how many times we've had to change the guide as we refine it. And even now, as I'm speaking to you, after this interview, I'm going to have a new version of the guide, because as people start interacting, asking questions and trying to access it, you identify some gaps, in some instances, some difficulties, and you start saying, no, let me remove this so that things can work better and faster. For example, with the COVID-19, the scheme, initially we had said we want to pay the workers directly.
Yes.
And then we realized, you can imagine if you have to have all the companies of millions and millions of workers, how possible is that? Now we started to say, let's work with bargaining councils, let's work with banks to see where we are saying, for example, with bargaining council, we sign an agreement, which we have done already with the Clothing and Textile Bargaining Council. We sign an agreement with them. We take the money, we pay to the bargaining council then pays it.
Come across, and it's called the death benefit. Will that death benefit still exist? And please, if it does, take us through that.
Death benefit still much exists. How it works is, if a member who's been contributing has passed away and is a breadwinner, what would normally happen is, if they already have a spouse, then the spouse would normally be the one who comes forward to claim. If they have a living partner, the living partner would normally come forward and claim. If there is none, but there's kids and they are above 18 years, then the kids will come and claim. Obviously, we would need an affidavit, would need birth certificates and all those things. So the scheme, the forms are already available on the website, and the requirements are already on the website. And then that you can not only apply for at the offices. It's not something that you can do online, because we need to see physical documents and the affidavits and all that. So death benefit, yes, it still exists. It's one of the normal benefits that we have as the UIF. And another one that is new outside of the COVID now, talking general about our benefits, we also have parental benefit, remember. Which we started working in November last year, but the part that was that started to work was for the 10-day leave that is given to new dads, to new fathers, where if I have a child and I already have, I know that my wife will be giving birth on a particular date, then I can apply for the parental benefit. So all the information and the forms, that's all available on the website.
Makosi, it seems as if all the information that we're talking about, in fact, you've indicated that all the forms and all the information is available on your website. And you've given us the website address, www.labour.gov.za. But my question now is, how do people access it? There are people, obviously, who cannot access it due to the lack of financial means or any other means that deter them from being able to access the internet. What are your efforts as a department to make sure that that information that exists on your site is filtered down to the communities who are waiting for such information?
Well, in terms of communicating and disseminating the information, we use platforms as this one. And I've been on radio most of the time since the start of the COVID-19. But in terms of accessing our benefits, the process normally started by the employer under normal circumstances.
Yes.
Let's take away COVID-19 at the moment. In any case, the employer is the one who normally applies, who sends the forms to us. What they only need from the employee, usually it is for them to go to the bank to have their bank stamped, But if they have the letter, then we will accept the letter confirming the account. So in any case, mostly it's the employer who has to kickstart the process, and employers do have those resources. It's such a pity that now under these circumstances of the shutdown, it's a bit of a problem. But with all our products, it's the employer that has to fill out the form, send it to us using their resources. And even after the lockdown, when we continue with the normal work, the employers will have to assist their workers if they have to claim UIF benefits by assisting them to fill out the forms, the part where they have to fill out, and sending them to us. So mostly we rely on the employers to assist with that.
Thank you so much. Thank you so much for the information. Thank you and goodbye.
We're going to take a short ad break. When we come back, Octavia and Lovu will address the latest fake news.
Welcome back. Before the ad break, we had Vicky McCullen with the latest news. The fake news infodemic in social media has become a feature of the lockdown. A 55-year-old man has been arrested for circulating a video claiming that COVID-19 test kits were contaminated. Earlier, I had a discussion with a veteran journalist and fact-checking advocate, Raymond Joseph, on how to verify fake news this time. Raymond, thank you so much for joining us, and welcome to our segment with fake news, where we'll be addressing fake news and how to verify fake news. As you know, we are facing lockdown, and there is so much fake news circulating on social media, especially on WhatsApp. So how can our viewers verify information and things like that?
So listen, you're not going to be, first of all, let me say that you're absolutely right. I've been fact-checking for a long time, and I haven't actually seen a deluge like this around one subject. I guess in the days of Bell Pottinger and that white monopoly capital, there was a lot, but this is on another level, because not only are people creating local stuff, but there's also stuff coming from overseas that's being repurposed. So, having said that, probably the best advice I can give to anyone is make sure that you take your news from a source that you trust. And that's not your auntie who knows someone who knew a doctor who worked at a hospital on WhatsApp. You know, so the biggest problem we're facing is not so much with Facebook and Twitter, because they're public. And they have a way of self-correcting. That if you put up something that is fake, that is wrong, someone is going to come and say, that is wrong, and they're going to correct you. Sometimes politely, sometimes impolitely. Also, Facebook is removing a lot of that stuff. They are removing hundreds of thousands of things a day, I was reading the other day. The real problem is in WhatsApp. So I think, and that's where people are seeing a lot of this stuff. So I'd like to talk about WhatsApp. I think the very first thing you need to do with WhatsApp and see if something is forwarded. The moment that it's been forwarded, you know that the person who sent it to you is not the original author of it. When you read something, do a basic Google. Google for the subject. Have the Chinese been hijacking and stealing the world's masks, for example? I saw one of those. Honestly, you just need to Google for that and add fact check to it, because most of the stuff is being fact checked by fact checkers. The other thing is, when someone sends something to you, ask them where they got it from. How did they get it? Because really, you need to get back as close to the source. There's really a lot of stuff, and and what we are seeing is a thing called confirmation bias. Confirmation bias, put very simply, is that people will go out and look for stuff that confirms what they believe, and they will ignore stuff that doesn't fit in with what they believe. So if you believe that you can catch COVID-19 from your dog, then you're going to go out and you're going to look for all kinds of stuff that talks about how people are catching COVID-19 from their dog. You're not going to go and look for a fact check, and there are lots of them out there. Can you catch COVID-19 from your dog? Can you be infected by your dog? So it's really important. I think the most important thing are trusted sources. You know, be it, so the media doesn't always get it right. You know, we are also human. We also make mistakes. But if you stick to a source, like Amabungani, like the Mail and Guardian, like the Sunday Times, like Times Live, for them, they should be checking and usually are checking. For them, there's a real world consequence when they get something wrong. Just the other day, I don't know if you saw.
I was going to touch on that actually.
News 24, the News 24 apology. I mean, there's real where they apologized about Bill Gates. I mean, it would have been quite easy to check that. And the moment I saw that, by the way, it didn't ring true to me. With the amount of money that Bill Gates has invested, you know, and he's very tuned into Africa. He was in South Africa recently. He's become big buddies with Trevor Noah. You know, would he really be saying in public, "Oh, we're going to use Africans as guinea pigs"? You know, so sometimes what you need to do is you need to ask yourself, does it ring true? Would someone really say something like that? I mean, the other one about Bill Gates that gets around is that Bill Gates is a shareholder in the company that has got the patent on the COVID-19 virus. I mean, really? Yeah. Why would he? So the truth is that Bill Gates. So with this fake stuff, the best stuff has always got a grain of truth. And then it gets embellished. And the case of Bill Gates being a shareholder in a laboratory that owns the patent to the COVID-19, as it happens, Bill Gates has donated millions and millions of dollars to a laboratory which is actively investigating the COVID-19. So there's the grain of truth, but then it becomes actually they've already got it, and they've got. I mean, why would they have copyright over it? So again, just ask yourself, does it make sense? Go and Google official sources with the numbers. The Department of Health have done extremely well. They are a bit slow in releasing figures, but stick to their figures. And there's quite a few. There's a very good dashboard called Media Hack, MEDIAHACK. Just Google for them and coronavirus, and they are doing an excellent job of taking the official statistics and putting them in a more presentable way. But really, don't the stuff. So I received another one yesterday that said it's supposedly from a doctor at a hospital in Mshlanga Rocks, and he has confirmed, the hospital's laboratory, it says, has confirmed that they've discovered that coronavirus can live up to 72 hours on vegetables and fruit. And the advice there is don't eat salad.
All right. Sorry to butt into there, Raymond. We have run out of time. I'm sure there's a lot of fake news that we need to address, especially in this time, and we have 2 more weeks to go. But thank you so much for your time, and thank you so much for giving us.
So I just want to add.
Yes.
People must be very careful. There are real world consequences for that, for what you're spreading. The authorities are run off their feet. The health authorities run off their feet. People need to be careful. Don't become part of the problem. Become part of the solution. Don't spread fake news. Thanks.
Thank you so much, Raymond. As you heard, that was Raymond Joseph, who is a veteran journalist, and that's what he had to say about fake news segment. Thank you, Raymond. Thank you so much.
Bye.
Bye. If you're unsure of a video or WhatsApp audio you've received, you can send a message to AfriCheck. It has set up a WhatsApp fact-checking group to help citizens verify information is correct. You can add them on 082 709327. Today is World Health Day, the day we celebrate the work of those working so hard to keep the planet healthy. Remember, everyone, keep washing your hands and maintaining social distance. We're all in this together. The following PSA comes courtesy of the World Health Organization.
Nurses are the real-time heroes, and they are at the frontline heroes.
My motivation was just helping people.
Someone that can sacrifice his life to save someone's life.
I love my job, my work.
We have COVID patients, they're trickling in.
I saw the city that became silent in these weeks.
It's so easy. I think that I spent a lot of time with COVID-19.
We started to apply all the measures to avoid the contact, and all of a sudden I am infected.
The inflows of patients is really, really overwhelming.
간호사라는 소명의식이 가장 큰 힘이라고 생각합니다.
We're seeing services transform overnight.
Surgery wards became COVID wards.
We have a clinic in the garage, totally detached from the main hospitals.
Y son las enfermeras las que están a su lado, o a veces consiguen hacer videollamadas entre el paciente y la familia para que puedan despedirse o puedan hablar.
Our labs have been informing us that they are slowly running out of test kits.
We're working on making the videos for donning and doffing of PPE, how to wear a mask properly.
We still have a shortage of nurses.
If we can have enough staff and provide the right equipment, I think it will be easier to care for the volume of patients.
Take our ideas into account and listen to us.
The care is still there. You can still see, even behind a mask.
To my colleague nurses, I want to say, you just inspire me.
We are motivated because right now, if we don't do it now, I don't think there'll be another chance for us to do.
Please stay home for us.
We've got this, we can do this. It's the nursing that will make such a difference.
And now for our social media. Share your thoughts with us on Facebook. We are Our City CT, and on Twitter at Our City CT. This is a time we need to come together as a nation. These are the popular hashtags on Twitter today. If you want to be part of this conversation, you can do so by going onto our Facebook page using the hashtag #CTVCOVIDShow. These are the trending hashtags on Twitter. Hashtag World Health Day. The world is united today in recognizing and honoring healthcare workers around the globe, the extraordinary work they are doing in taking care of those affected by the coronavirus. Spread solidarity and not the virus. Hashtag Boris. News that British Prime Minister is in intensive care unit after his COVID-19 symptoms worsened has the social networks buzzing. But not all sympathetic noise. The Prime Minister's detractors are exacerbating the symptoms of decent human beings. SARB. South Africa's Reserve Bank has instructed banks not to pay dividends to shareholders and bonuses to executives, urging them to conserve capital to help absorb the expected COVID-19 losses. After the ad break, we'll cross back to Vicky McCullen with more resources and the latest news.
Welcome back. You're still tuned to Our City, the COVID show with me, Vicky McCullum. Before the ad break, Octavia and Lovu looked at what has the nation buzzing on our social media platforms. If you want to watch the repeat of this program, you can tune in again at 6 p.m. for your latest news around the COVID-19 pandemic and to see what other Cape Townians are doing to keep safe. Speaking about what other Cape Townians are doing, here are some organizations helping communities stay safe. Food Forward SA, established in 2009, is the largest food redistribution organization in South Africa. To get help with food or assist Food Forward SA, please contact Michael Davis on 0215310210 or email michael@foodforwardsa.org. The Sadc Department Centre, SBCWC, is a centre for women and children who are survivors of abuse. For more information on how you can help, please contact them on 02140245660 or email at info@wmce.co.za. Sisters Incorporated, for anyone currently at heightened risk for domestic violence due to the lockdown, please get in touch with Sisters Incorporated, a facility providing shelter for abused women and children. Their contact details are 021-797-4190. That's all we have for you today, but if you have something to say, we want to hear from you. You can send your comments, news and questions to us via Facebook at Our City CT, on Twitter at Our City CT, or get in touch with us via email on ourcity@capetowntv.org. This is a time we need to come together as a nation, so if you are not sure about something, send us your questions and we'll try to find the answers for you. You can also call us on 021-448-0448. From me, Vicky McCullum, and the Our City crew, have a great day. Goodbye.